Hi everyone, it's Margaret here with 60 and Me. Our medical issues as we grow are very complex, and I want to talk to you about how we can take control of our health as we get older. Now, I don't want to go on about this endlessly because you know that I was in the hospital recently having my gallbladder removed. I have no gallbladder anymore, and my poor little liver is coping all by itself and doing fine. But it just kind of highlighted for me the importance of this topic, and so I want to talk to you about you. I want to understand what you're going through and how you can control your health and your well-being as you get a little bit older. I think we all, if we are in our 60s now, most of the women in my community are 60, 70 and older. We've had kind of moments where we've had to really take a hard look at our well-being, at our health, at our physical situation, and deal with something. Some of you have got diagnoses of diseases and illnesses that are chronic and that really are debilitating. And my heart goes out to all of you because now I've actually lived a pretty charmed life, and I'm touching wood here. In that I actually have not had any surgeries. This gallbladder was my first surgery, and I've had reasonably good health. I mean, I've really taken care of myself, and I've been very fortunate. I mean, I'm honestly so grateful, but many of you have not. And we've got women in our, for example, in our Patreon supporters group that we're all working with right now because they're going through specific challenges with their health. And I want to encourage you, by the way, if you have got any opportunity to join our supporters group, that's a wonderful place to go if you're trying to come through a health medical reality, a medical challenge. And I think the most important thing to say, though, is it's normal. It's normal. I mean, disease and illness is not good. But as we get older, it's a reality. It's a reality that we have to face. And I think that that's really, really challenging. And I don't want to minimize, the reality of it for you. I'm going to just move something here because I'm realizing my light is just falling off of my little tripod there. Okay, stay put. So, not being the captain of your own health is all about taking care of yourself and being an active participant in your health journey. Now, what does that mean? Okay, regular doctor's visits. And I know that some of you don't have medical health, perhaps, or medical coverage, and that's really, really challenging. But whatever you can do to get on, a program or with some help that you can go and see a doctor, regularly to have tests and screenings. Now, I was actually reading an article recently that said, a lot of people go to their doctor and they're afraid to ask for blood tests. Or they don't want, the doctor never offers it. But I think that blood tests can be so revealing. And if you've got any kind of challenge with, pre-diabetic or anything to do with your blood sugar or, any other aspect that could be measured with a blood test, you should do it. I mean, I know it's part of, it's really funny. Like I actually, when I come out of the hospital, my what do you call it? The enzyme levels in my blood tests were not good. So I had to go in and have some more tests. And then when I had the tests, they were all normal. And the doctor said, well, go back in about a month and just have this is a hospital doctor, have your regular doctor just check it out for you. Well, it's been a month and I don't want to go back and have more blood tests. I seriously don't. I mean, I don't know what I would do if it was not improved because I feel really great, but I have to do it. You have to confront what's going on. And if there's something still going on with my enzymes, well, then my liver isn't doing its job very well and something is needing to be looked at. So you're going to have a good relationship with your doctor, good relationship with your healthcare provider, and I know what you can get. You have to be careful, of course, if there's expense involved. And I'm super sensitive to this because I know what medical bills can be. I know what you can be facing. So I think if you can just do that first, so have regular doctor visits and screenings if you can, do the best you can to make that part of your life. Another thing, of course, is totally within your control, and that's nourishing your body. Adopt a healthy and balanced diet. It's hard. I mean, I personally, I'm in a rhythm of eating a certain thing every day. But for example, just give you one example, I actually every morning would have granola, or not granola, like a muesli granola. It was very nice, but heavy on the nuts, heavy on the sugar, heavy on taste. I loved it. And every day I would have it with a bit of milk and maybe sometimes a little bit of cream. And that was my morning breakfast. And I know that was like maybe 400 calorie breakfast, and I didn't need it. It was just a rhythm. It was my practice, and I enjoyed it. It tasted good. Now I eat oatmeal. Now, some of you may say don't eat oats because they're not good for you and whatever, but for me, I actually find that I feel better. And I got steel cut oats, not just regular oats that you can buy in the shops. I actually got steel cut oats, which are less processed. They've got less processing, and so they're crunchier. And I just put raspberries on the top of it, little teeny bit of milk. That's my oatmeal. I love it. Oh, and some coconut sugar sometimes. But that's it. I mean, I think just doing little things like that and get serious about it. Like really talk to yourself, because your little brain is like just doing its best to keep things going just as they are. Keep going. That's how you've done it for like 12 years. Why? What are you bothering to change for? We know it's safe to do that, whatever. Your brain loves rhythm, routine, predictability. So another thing is supplements and medicines. Now, make sure, of course, that you have the right medicines. I think you know that I have blood pressure issues, and I've been taking a blood pressure medicine for a while, and a few months, quite a while ago, and I had a bit of a flare up. But it's kind of probably related to my gallbladder, but the pain of that. But anyway, I decided that I really needed to talk to the doctor, and we changed the medicine a bit so that it's just more aligned to what I need. And so that's it. Watch that your medications are doing what they're supposed to do, and just take care. The other thing is supplements. Now, I am not going to talk to you about supplements because there's 1,000 things you can choose. There's a lot of research. There's just so much you can do. But the classic ones that everybody talks about, for example, are the omega-3, the fish oil, vitamin D, vitamin C, B vitamins, and for me, a probiotic. I take a probiotic every single day. So that, really, I think with those, I mean, even just a good a multivitamin is probably perfect because it will cover all those. Magnesium, how could I forget magnesium? Magnesium is really important. And I take it in a drink, like a fizzy tab. And it helps me to drink more water and then drink my magnesium. So I think those are the only ones that I take. But maybe, and it's not, really necessary for everyone to share what their supplements are, because everyone's different. But I just wanted to say that is an area to think about. Are there areas that your food is not giving you those things? I mean, magnesium, for example, used to be in the soil, I think, and now, we don't have that in our natural environment. So magnesium is important. Exercise. Okay, come back. Come back, everybody. Don't go. I know, as soon as I say exercise, click, I'm gone. But anyway, I'll just mention it briefly, okay? It's that low impact activities like walking, swimming are just as good as cardio. And I mean, yes, I've got little arm thingies, I'm never going to have the muscles that I had before. I don't know. Bone density is super, super important. But, we can do that with food as well. But swimming and yoga are probably, for me, walking are the three that I would encourage you to think about if you're looking for exercise. And then, of course, I can't skip over this by not mentioning mental and emotional well-being. Your health, your stress levels, the things that are on your mind, the things that are bothering you are going to impact your healthy life as you get older. So foster good mental health. If you've got challenges, please try to talk to someone about it. Know that things in perspective can really change the whole situation just by talking to someone, a friend or a counselor. There's some really good online places you can go now and just do online chats, which just that one action can help. And here, just in our YouTube channel, you can talk in the comments and people will help you. I guarantee it. If you say, guys, I'm having a really bad mental health day here, could someone give me some help? You will get it. I almost guarantee it. We are a group of really strong women that are here to help each other. So that's the first thing. And for me, cultivating gratitude and a sense of appreciation for what I have also tends to tone down any stresses and emotional, because I have them just like you. I have days where I just, I look at the world, I look at my, the bigger situations, and I think, oh, this is crazy. I don't know. I'm just not dealing with this well. This is too much. But then I kind of look at the checklist of gratitude, positive things, and it makes me feel better for sure. Prioritize self-care. Being proactive and empowered. Advocate for your own health. Advocate for your own well-being. And another thing, actually, I've highlighted here in my notes is to stay informed of new treatments and medical advancements, because there's a lot going on that that wasn't there before. Take notes. And when my mom died of cancer, how many years ago? 50 years ago now. There was no medicine. There was no cure. There was nothing. There was just, simple action of mastectomies and just waiting. And that was the situation. Now it's very, very different. So look out for alternative medicines, alternative treatments. I mean, they're not right for everybody. Everything's, relative, but building a support network, I think, is really super important. Join the Patreon supporters group here at 60andMe. We've got some women in our group right now that are going through medical challenges, and we're all by their sides every time we're checking in on them, and that's a really good place to have a nice group of people helping you if you are facing some kind of medical challenge. But medical independence, freedom for good health in your 60s and 70s and older is so, so important. And I hope this has been helpful. I hope it's been encouraging and supportive. And I just want you to know that you matter to me. You do matter. I get a lot of email, I get a lot of messages, and I can't always answer all of them, but I do my best. And I just want you to know that the strength of 60andMe is really in the community. It's your sisters here. And if you can, use these platforms like YouTube and others, Instagram and so on, to just chat with people and then come on to the conversation on YouTube and even TikTok if you feel like going there. You don't have to go to the crazy part, by the way. It's actually a very good platform, in my opinion, for certain things. But, use the channels that I've got and know that we care. We care about you. We really do. Okay, everybody, take care, have a super day, and go out in the world and shine. Take care. Bye for now.